want to give you a bit of a sneak peek into neck pain and what the webinar is going to include. So thanks again for joining me today as I talk about neck pain here on YouTube Live. So I have a clinic at Tutt Street Family Chiropractic in Kelowna, and I'm a chiropractor who's been practicing for 30 years now. And my journey into chiropractic started when I had knee pain, and my father took me to a chiropractor when I was around 14. And that really helped my knees and inspired me to help others to become a chiropractor. Now, as far as neck pain goes, it's the second most common condition we see in the clinic, the most common being back pain. But when people have neck misalignments, it can cause pain in the neck area. And I differentiate the neck into two regions. One is the upper part of the neck right here, C1 and C2. These nerves travel upwards into the head region, above the eyes, can cause headaches. Then from C3 to C7, right down here, these nerves go downward and they go to the tips of the fingers. So if you do have misalignments in the lower neck, you're more likely to have pain that's going to be traveling from the neck into the shoulder down your arm. If you have misalignments in the upper neck, you're more likely to have pain in the head region, causing headaches. And at the webinar, we'll be talking about posture and that poor posture can cause neck pain. The last patient I had in today, she was actually talking about her daughter having poor posture when she's knitting. And as she's knitting, her head's forward and it's causing a bump in the back of her neck. So I was explaining to her that it's good to get children or teenagers checked now before it gets too late, where it becomes a chronic pattern. So we always want to deal with poor posture immediately and change the alignment of the spine and improve the posture. The muscles can get strained by overuse or injury, and that can cause inflammation, spasms, and tenderness in the neck area. Injury, like car accidents and whiplash, can cause damage to the bones and discs, and even the nerves in the neck area. And finally, degenerative conditions. I'm just going to turn off my picture here so you can see. Degenerative conditions like aging, wear and tear can lead to degenerative changes in the cervical spine, like osteoarthritis, degenerative disc disease, spinal stenosis, and herniated discs. So we can see numbness and tingling with that, weakness, and poor movement in the neck area due to these conditions. Oops, sorry guys. That's the second time that's happened to me. I'm just going to get the presentation back 1 second. Okay, I think we're back. Oops. Well, we were back. Let me just go to the PowerPoint and there. And so I should be able to scroll sideways now. Now, treatments for neck pain. First, we want to make sure the treatments are safe, gentle, and effective. So we don't want to do anything that's going to cause more pain for the patient or risk any harm. So we're very careful with the adjustments and treatments that we do. We'll do an initial consultation where we're going to sit down and understand your neck condition better. And from there, we're going to do an examination. And that's going to involve ranges of motion, posture, palpation to check the vertebrae. It's also going to involve some testing like orthopedic neurological testing to see if there's any nerve pressure, any joint damage. Then we'll have a diagnosis, which we're going to share with the patient and discuss that, and then present some treatment options. Now, these treatment options can involve hands-on adjustments. They can involve instrument adjustments, which I'm going to show you in a minute. And we also use shockwave and laser in the clinic to help heal the joints and the tissues. So let's talk a little bit more about that now. There's a lot of research that's been going into chiropractic for neck pain. Like in 2012, there's a randomized controlled trial comparing spinal manipulation, medication, and home exercises for acute and subacute neck pain. And the results showed that spinal manipulative therapy, or hands-on adjustments, was more effective than medication in both the short and long term, had similar effects as home exercise. So that's good. In 2017, there was a review and meta-analysis of spinal manipulative therapy, SMT, for chronic neck pain. It found moderate evidence that SMT was superior to sham SMT, or the placebo, or no treatment at all. And low to very low evidence that SMT was better than other interventions for short-term and long-term outcomes. And then a 2019 randomized control trial compared SMT and mobilization for neck pain, and the results showed that both SMT and mobilization were very effective in reducing pain and disability and improving quality of life, but there was no significant difference between the two. So there's some research that's gone into neck adjustments and neck pain, and so you can see that it's more and more accepted all the time, the types of treatments that chiropractors do and the scientific basis behind it. Now, for hands-on and instrument treatments, I like to incorporate multiple techniques into my treatments. So, for example, what I did is I grabbed this instrument called the activator, and I hope you can see that. And with the activator, we do adjustments to the vertebrae just by tapping them into a better place, adjusting the vertebrae, realigning the spine, improving the range of motion. So that's a very safe and gentle technique called instrument adjustments, or activator. I have another type of instrument called an integrator that I do like to use, and the integrator is a gentle tonal technique that I can use to adjust the spine and release the tension. And then, of course, there's that hands-on adjustments. And hands-on adjustments are done using traditional methods by adjusting the neck area either face up or face down, and pushing on the vertebrae. And now, sometimes when we push on the vertebrae, you might hear a pop or a crack, and that's just part of the treatment process where the gases are shifting or releasing between the bones, but not the bones rubbing together or against each other. So there's some misconceptions sometimes about that, and we just want to clarify and make sure that people have the right information to make an informed decision. Now, the other thing that we do in the clinic is shockwave and laser, and I have the laser and shockwave cart right behind me right here. And I do use shockwave and laser on the neck area and the nerves and the soft tissues like the trapezius muscles. And it's been very effective because it's non-invasive. Shockwave is acoustic waves, or sound waves, that can go into the body and break down scar tissue, promote tissue regeneration, reduce inflammation, and accelerate the healing process. And then laser therapy is light therapy, and the light goes into the body, basically does the same thing. So reduces inflammation and pain, swelling is reduced, enhances cellular regeneration by stimulating the mitochondria in the cells, and promoting tissue repair. So very effective techniques to use on the neck area as well. In addition to chiropractic treatment, I like to give my patients lifestyle advice, and that advice is like stretches and exercises to do, better posture, better nutrition for their joints, sleep habits, kind of changing their lifestyle, forming new habits instead of old habits, and I call that health coaching. So I do offer a service in the clinic where we make a custom plan for the patient, sit down and follow through. There's some accountability to acting on the plan, and that's just going to help them in conjunction with chiropractic care to get better. We also have products in the clinic. products like contoured pillows to correct and support the alignment of the neck. We have neck braces. We have creams and pain relief products. So a number of different products that can help with posture, nutrition, and pain relief. We do assessments in the clinic on a regular basis. So as the patient goes through treatment, we're reassessing them to make sure that they're healing. And if we can do things better, maybe the activator adjustment is working better than the hands-on, maybe shock waves working better than laser, then we'll go with that technique. And so we're constantly trying to improve the treatment, and then some accountability like progress examinations, getting the patient's feedback, as well as our reassessment, postural pictures again to compare to the initial treatment. All of that helps us to determine if the patient's getting better and if there's anything we can do better to help them. So the key takeaways today are that chiropractic can help with neck pain. There's different causes of neck pain, and depending on the cause, we're going to do a certain type of treatment, whether it's hands-on, instruments, using shockwave or laser. It's all very helpful to rehabilitating the neck and getting it in better shape. Now, if you're interested in to learn more about neck pain, then I'm just going to switch slides here. And I did write a book on neck pain, and it is right here. And in this book, I talked about the different types of conditions relating to neck pain. So I called it neck pain, but it includes headaches, whiplash, and concussions. So there's chapters on those topics. And I use many patient examples over the years of people that have come in with neck pain, with headaches, whiplash, and concussions, and what we do for them. I published that book a few years ago, back in 2019, and I do have some copies in the clinic, and the audiobook is out there, as well as the paperback and the ebook. So if you're interested, you can go to Amazon and get a copy of the book called Neck Pain that I wrote in 2019. And then the other thing that I wanted to go over with you is how to book an appointment. So we are accepting new patients in the clinic. And if you do want to book an appointment, booking an appointment is pretty simple. So I'm just going to go over that with you. And I'll get over to that screen. Okay, good, got it. So if you type in tuttstreetfamilychiropractic.com, then you'll be able to go over to these buttons that say book now. Now, these are for new clients, and we are accepting new clients without a doctor referral. So we're primary healthcare clinic. You can come in and directly see us. We do bill directly to insurance, including ICBC. And we can often see people the same or the next day, and we're open 7 days a week. So it's very convenient for people, especially with hectic schedules, people that want to come in later in the day, earlier on the weekend, Saturday or Sunday, or a holiday. We do have appointments available. And the process is really easy. What you do is you go to the book now or new patients right here, click here, and then you can go in and book an appointment right into our calendar. So this will take you to the booking page, and then you just click on book an appointment. You can look for a day and time that's available, so like tomorrow morning at 8:20, and then when you click on that, it'll ask you to enter your information. So your phone number, email address, first and last name, any notes. So, about your neck, why you're coming to the clinic. It's always helpful to have some notes when you first book your appointment, and then click book appointment. You're going to get a reminder immediately about the appointment, and then you'll get one 2 hours before. You'll also get an email, and then the clinic will send you an introductory text welcoming you to the clinic, as well as a link where you can fill out the new patient paperwork, and then we'll be ready to go when you come in for your appointment. So booking is easy. Coming into the clinic, very easy. And the treatments, we'll do your assessment, give you treatment options. The adjustments are safe, gentle, and effective, and in combination with shockwave or laser can make a really big difference in a patient's life. So I want to thank you guys for joining me today. I just thought I had a few minutes where I could kind of share with you what I've been working on